Right, my name is Dr. Tim Alexander. I'm the Chief Plastic Surgeon at the Florida Center for Cosmetic Surgery in Fort Lauderdale. But today we're going to talk about breast implants. Righto, well, I've been doing breast implants in Florida for over 40 years now. We use two main kinds of implants, saline and silicone. And there's several ways the implants can be introduced into the body. The most common are via the areola and in the inframammary fold. They can be done through the armpit and the navel as well, but we don't do those here. The most suitable person for an implant is one that hasn't had any weight loss or breastosis or children, but even if they have, sometimes just a straight augmentation will be great, but sometimes you need a little ancillary procedure like a small lift or a full pattern breast lift to get the full perky, lifted up projection look. The size depends on the patient, and they can go really up to 1500 cc's or as small as 200. So it depends on the patient and the interview with the doctor, me or one of the other doctors here, and you have a conference and determine the size that you want to be. Usually it's best to be slightly larger than you might think, because after all the swelling goes down, you can be disappointed. So we've learned over the years to get it just about right. Every now and again you'll get somebody who needs like a little bit more saline added, but that's not all that often. Usually, and it's very seldom that people get them too big than what they wanted. Okay, now the implants really, they used to say that they had a 10-year lifespan and you had to change them every 10 years. But after 10 years, they're not giving you any trouble. They should be good for life now, the newer ones. The old silicone implants, if you got silicone implants more than or 20 years old, you want to get them changed because they had very fragile shells and they tended to disintegrate. And often we'll see somebody who wants to change the saline, take the silicone out, and they're broken. Patient wouldn't even know because the body, and it's not dangerous either, because the body forms a scar tissue around the implant when it's put in. So, you know, the nightmare of the silicone traveling somewhere else in your body is not going to happen because your body shells it off with its own scar tissue. The problems you can have with them, every operation has got its drawbacks. You can get infection, bleeding, capsule formation. What capsule is when the body kind of forms a reaction to the implant and forms more scar tissue around it than a normal, and that can be treated with medications and ultrasounds, and sometimes even having to do an open capsule release when you take the implant out and cut the scar tissue out. But that's probably about 10% or less of the cases that we do. The most common occurrence is that people usually want to go bigger after a few years, which is easy to do. You just go back through the old incision, then you make a scar tissue, which is called a capsule. You release it in a few places with some incisions, and then pop the new implant in. It's a very little downtime, and it's quite comfortable to do. The surgery itself, if it's a straight breast augmentation, takes between half an hour and an hour to do. And it's done, we like to do them under general anesthesia, although there's some people that do them under local, but to me that would be a nightmare because it would be very painful. And also there have been a few people that have been overdosed with local anesthetic, getting them done under local anesthetic, which is a problem. And you need to go to hospital for that. So we do them all under general anesthesia. They take half an hour to an hour to do. Then you go to a recovery room for an hour, and then you go home. Come back the next day for a quick checkup, and then a week later we show you how to do massages. And if you've got a light duty job, you could probably go to work in 3 or 4 days, but it's a month before you can go back to the gym and do full body workout exercise. The question is, how soon after pregnancy should you contemplate getting breast implants if that's what you want? Often after pregnancy you're going to need a breast lift too, but sometimes just a straight implant will be fine. And it's probably best to wait after you've stopped lactating or 3 months, whichever comes first. Another question is the size and shapes of the implants. Well, the basic size is just measured in cc's. We started about 250 going up to 800 cc's, and the question of the shapes is sometimes a bit different. There's many shapes, and it really does. The shape is the best. The medium to moderate profile or high profile are the most satisfactory results in my hands. But the flat ones and the teardrop ones and are not very satisfactory. And textured implants, if you've got them, you might want to get them removed because they've been proven not to be satisfactory. Now the question is, where are the implants placed? Well, 99% of the time we place them underneath the pectoral muscle, or it's a composite type implant with the top part's underneath the muscle and the bottom part's still exposed to the breast tissue. Doing them on top of the muscle, especially saline ones, is not very satisfactory because you get a lot of rippling. In some cases, silicone ones will do fine on top of the muscle, but we seldom do it that way. But some people will request it because they're athletic and they want to make sure their pectoral muscle is intact and powerful, so we will put it on the top of the pectoral muscle in that case. Okay, now if you want more information on this topic and others, feel free to contact us on the phone, emails. Girls are doing virtual consultations, and sometimes we'll have virtual voice consultations as well as visual ones, and we can work out with you and give you a lot of information before you even decide what you want to do or how you want to progress with the surgery. Then if necessary, you want to come in, we can quite happy to have a chat with you and go over the procedures again in person, me or one of the other doctors. Okay, if you like this video, don't forget to like and subscribe. Thank you.